And welcome back to The Factor Uncensored. You may have noticed a lot of people wearing red today in your neighborhood, community, around the country. Many people are recognizing Go Red Day. Why go red? It helps raise awareness about the heart disease and strokes in women. Dr. Danish Ali from Archpoint Pain Institute is here with us tonight. When we talk about women's health and we talk about strokes and their heart, how susceptible are they to those problems? More than men, less than men, or we just need to focus on just a healthy heart?
We really do, Isaiah. You hit it right on the point. I think that risk factors are there for men and women. We have similar risk factors, whether it be high blood pressure, diabetes, high cholesterol. These are all risk factors that men and women have. The difference is that the presentation may be a little bit different, right? And so men have classic chest pain. It's pounding, right? It feels like an elephant sitting on their chest. Whereas women, it's more subtle. It's more like, I've got back pain or I've got heartburn. And those are, they may be some symptoms. And
why do we have those differences?
Just how we are. I think that women are more susceptible and they recognize pain in a different way. And especially chest pain, they recognize in a different way than men do. And so we all know, and men and women have differences in pain thresholds as well. And so I think those are all differences why we have different presentations of how we see it in men versus women.
Now, building that healthy heart for a woman, what should they be doing on a daily basis to keep their heart healthy?
Right. So obviously it's maintaining a good lifestyle, whether it be healthy eating, whether it be walking daily or every other day if possible. And then also mitigating all those risk factors that we talked about, right? So high blood pressure, making sure your blood pressure is in control, making sure that your cholesterol numbers are in control, making sure that your blood sugar, diabetes, those are things that you need to exercise. You know, if you're overweight, lose weight. If you are smoking, that's the other thing. That's a big risk factor, right? We know that smoking vasoconstricts your arteries and it causes plaque buildup, and so that can cause heart disease and heart attacks as well.
What are some of the easy ways that women can make sure they stay healthy when it comes to their heart? You mentioned walking. Correct.
Yeah, so walking, eating healthy is also very big. Mitigating and controlling all those risk factors that we just talked about, and especially if you've got a family history. So if your loved ones, family members have had a history of heart disease, those are folks that you may want to get in with your doctor a little bit sooner. Maybe you want to get an EKG done, take a look at your heart. May want to look at your blood work as well to see what your cholesterol numbers are, what your blood pressure, blood sugar numbers are. All of those are things and risk factors that you can control, right? Some things that we know, African Americans, we know they're at a higher risk for heart disease, strokes, and those sorts of things. But those are non-modifiable risk factors, and then there's the modifiable ones, right? And so blood pressure, diabetes, cholesterol, those are all modifiers. Those are things that we can fix, we can work on, we can improve our diet, we can walk, we can exercise, those sorts of things.
When we talk about those tests in order to make sure women have the healthy heart, how often should they do them? Once a year? Biannually? How often?
That's a good question. So Isaiah, it all depends on your risk factors, right? So if you've got a family history of someone who had a heart attack at a young age, then you may want to get in at a young age as well and get your heart looked at. You may want to get an EKG done. And so those are all things that you want to do a little bit sooner than later if you've got a strong family history, or if you've got a strong history of smoking and or you're overweight, don't exercise, or you have a sedentary lifestyle, you're behind the desk all day in the computer and not exercising. Those are all risk factors, and so that may want you to be a little bit more aware of this and especially know your body, right? And so if you're having any of these symptoms, chest pain, chest discomfort, or you may be walking and you got to stop and you got to take a rest break.
Don't put it off.
Don't put it off. That's what we tell. It's always good to get in early, get that EKG done, get your blood work done, and you're ahead of the game.
All right. You even wore your red today.
I did.
You got the memo. Thank you, Dr. Danish Ali from Archpoint Pain Institute.